just want to take the opportunity to welcome you all to the 5th Annual Marne Behavioral Health and Primary Care Summit.
The purpose of this event is to provide continuing education credits to the providers here at Fort Stewart and in the surrounding community. The continuing education credits allow providers to maintain the requirements of their license so that they can continue practice.
We have several guest speakers, but the one that's kicking us off today is Dr. Thomas. He is a retired Major General, and he will be discussing behavioral health medicine and the way forward and where we've come and where we're going.
Kind of following the 5 W's here. Number one is, what are we about in the military health system? Secondly, I want to talk about some innovations and advancements and things that have made us be better. Things that make military medicine really the leader in innovation and in medical science.
It's always a pleasure and an honor to come down and talk to folks who are actually doing the real work, and that's taking care of our patients, our troops, and their families. I think after 16 years of continuous combat operations, the importance of behavioral health care to our troops and all of our family members and retirees has never been greater than it is now.
I'm a part of this because I believe in educating our providers to be the best providers that we can be. I was one of the original members of this grassroots effort to just bring high quality education to our providers, and it's just been something that is near and dear to our hearts.
I think a big piece of this is that it gives us as an opportunity to get out of our comfort zones, if you will. If we're only working with Air Force clinicians or only working with Army clinicians, then we're not having the opportunity to really see what each branch can bring to the table.
I think it's a force multiplier because you have people from all over the region coming together to talk about readiness.
So the Marne Health Summit, both the behavioral health and the primary care tracks of the summit, help ensure that we are providing the best practices for our soldiers. And we actually ensure that some of the topics are specific to the care of the soldiers to help ensure readiness for them. So not only are we making sure that we are ready and able to care for these soldiers, we're also ensuring that our soldiers are ready.
Very few problems are solved by one doctor, one nurse, one medic, but rather it takes a team approach. It requires many different disciplines coming together. It requires not only those from our hospital, but those from the surrounding community that support our organization, that support the 3rd Infantry Division, that support the soldiers and families of Fort Stewart, and support the greater Army, which is why this training event is not only for those here, but those in the greater area as well, to ensure we develop those collaborative approaches for how we can best ensure the readiness of our units to meet the nation's calling.